60 Minutes Overtime.
Now, I didn't hit the we, I remember.
You did the we. You did
But
hit the we.
I did?
Here we go. All right.
Stand by.
Aid in dying, or what opponents call assisted suicide and supporters call death with dignity.
Your first
relies on
60-minute
people
story.
taking the medication.
Right.
How does that feel?
I am not even this much blasé. This is what blasé does not look like.
Yeah.
Just relax.
Just relax,
Just
okay.
relax.
I didn't get to say, I'm Jon LaPook.
Were you hoping to say that?
Well, just a little bit maybe. But no, I realize that's something you have to earn.
Dr. Jon LaPook is on 60 Minutes this week as a correspondent with a controversial story about terminally ill patients who want to end their own lives by taking lethal medication.
We need to, as a nation, start talking about this some more. It's really important. These conversations about end of life are a lot easier when end of life isn't staring you right in the face.
Here, LaPook interviews the son of a cancer patient.
You've thought about this a lot.
Yeah. There isn't a day where I won't wish that there would be more time. But there will very easily be a day where I wish there was less suffering.
You know, he's born with a compassion. This story he's doing is a story that requires a lot of it. You know, it's an end-of-life story, frightening to a lot of people, and important.
Jeff Fager, executive producer of 60 Minutes, greenlit the story.
Did he bring that story to you?
Yes, he did. You know, it really is a limited group of people who go on 60 Minutes, and he hadn't done it, and it just seemed to me that based on his body of work at CBS News, he should have that shot.
Joining us now is our new CBS News medical correspondent, Dr. Jon LaPook. Doctor, welcome.
Thank you.
10 years ago, Dr. LaPook started his life as a reporter on the CBS Evening News. At the time, he was a respected internist and gastroenterologist, but he had almost no TV experience.
It was Bob Schieffer, holy mackerel. Bob Schieffer.
Now, how different is this from other drugs?
It's different. It's a new type of drug. It actually works.
You know, I don't think he was natural on television at first. I think it took him some time. But, you know, he's really gotten good. He's a doctor by training, but he's learned to be a reporter. And in some ways, especially someone who really loves medicine, they're reporters too. They're trying to solve mysteries all the time about illness.
This used to be the Ministry of Health. Rebuilding it will be the easy part.
Over the past decade, LaPook has been the frontline reporter for CBS News on almost every big medical story. The Ebola virus, the Boston Marathon bombing.
Dr. Jon LaPook has been talking to the people there. John, what'd you find out?
Scott, at Boston Children's Hospital, which is where most of the kids were taken.
The Zika virus.
In just 1 week, we've learned first that it could be sexually transmitted.
We've kind of watched the evolution of the doctor to television reporter, but also very persuasive pitchman for the right kinds of stories. You know, now he's got a story on 60 Minutes. God bless him.
Steve Kappas is LaPook's boss at the CBS Evening News with Scott Pelley, where LaPook is known for being meticulous.
Dr. Jon LaPook, thanks, Doc.
If you're super meticulous, medicine that's a great field for you, and journalism also.
He's caught errors in published medical studies and in statements by public health officials.
You know, half of the people aren't getting the right treatment. That's pretty startling.
With a lot of television doctors, you get the feeling like it's a good thing they're not treating patients anymore. But Dr. LaPook is still a practicing physician.
Yeah, John's full-time role is being a physician. There was a time recently he was doing a Facebook chat.
Hi, I'm Dr. Jon LaPook. I'm the chief medical correspondent for the CBS Evening News with Scott Pelley.
While he was in the midst of it, he got a call from a patient.
Hold on a second. Dr. LaPook. I'll talk to you soon. I'm actually being filmed right now for a Facebook chat, but you're fine.
He didn't stop the chat. He said, I need to take this call.
Stay on the medication that I switched you to, and I will talk to you in about 15 minutes.
He's literally doing both jobs at the same time.
Yes. He can tell us what's really happening in public health.
The best things that I can pitch are things where because I'm a physician, I can feel a story bubbling up.
Hasn't made the news yet.
It hasn't made the news yet, but I kind of hear about it and I can feel it.
That's what happened in 2011 when an old classmate of LaPook's mentioned that a cancer drug was becoming hard to get.
Kids, babies with cancer, were not able to get cancer drugs because there was a shortage.
Sounds like a big story.
Huge story. It turned out there was a bill that had been introduced in the Senate and in the House to help fix this. Everybody supported this, and yet it stood in Congress for 15 months, and nothing was happening.
LaPook pitched the story to producers twice, but they rejected it.
Then finally I said, it's babies with cancer not able to get drugs. So they said, do it.
In December, 8-month-old Elena Schonefeld was diagnosed with leukemia. But the cure depends on a cocktail of chemotherapy drugs, and a crucial one is running out.
And you ended up actually pressing our leaders in Washington.
That was the last place on earth when I graduated medical school that I thought I would be one of these people raising my hand. I said, why is it taking so long?
When we spoke to the legislators, they said to talk to you about the leadership.
I respect the committee process.
So then I went to Harry Reid. When is that going to happen?
Well, you're asking me to look into the future.
2 weeks, next 2 months, next year?
I hope to get it done sometime.
They're not seeing the 10-month-old baby, Elena, who's dying of cancer.
Do you think the story made a difference?
Well, a couple of weeks later, they passed the bill.
And sure enough, today, the bill passed the Senate 96-1.
People get embarrassed, the law gets passed, and boom, lives are saved. So yeah, that could have been why I was born. That one story.
Dr. LaPook has roots in both TV and medicine. He comes from a long line of medical men going back to his grandfather. But he married into television royalty. LaPook's father-in-law is famous sitcom writer Norman Lear, who was once interviewed by Mike Wallace on 60 Minutes.
All in the Family, The Jeffersons, Maude. Why so much?
And that's how a young LaPook found himself at the home of 60 Minutes creator Don Hewitt some 30 years ago.
I was early 30s. The last thing in the world I was thinking about was that someday, years later, I would be on 60 Minutes.
Sometimes, on assignment, LaPook has to draw the line between practicing medicine and reporting on it. It happened in Haiti after the 2010 earthquake.
At the very beginning, there were very few doctors there, so if you're there, you want to help, and that, of course, is the instinct.
Melissa, does she have a fever?
99.1,
I had seen those kind of crush injuries before. I was trained at Columbia Presbyterian Medical Center. I think I saw everything under the sun, from buildings collapsing on people to fires to shootings to stabbings. This is the late 70s, early 80s when I was doing my training.
And her blood pressure?
I told the producer who I was with and the cameraman that if I ever come to a time, which did happen, where I'm flipping into doctor mode, just turn off the camera.
Why?
I think there is an unavoidable conflict of interest.
So in the field, when you're reporting on a medical story and you see someone in need,
I'm thinking, don't use the fact that you're a physician to get publicity for yourself, to get ratings for CBS or for anybody else. This person may be depending upon you for their life. Nothing else. Focused. Just that person.
Newsroom colleagues of Dr. LaPook won't be surprised to hear that. He helps them too. They pop into his office to discuss highly personal health problems. LaPook keeps his medical bag on hand.
What's very important are the blinds and the lock on the door.
Are you thinking of putting an exam table in your office?
I don't know, maybe.
Our people are always on the go. There's something going on. They're going into war zones. They're going into places where there are public health emergencies. There's bound to be issues that our people face.
This week, you'd find probably a dozen people that he's treated in one way or another in his office.
How do you feel about being in that role here?
I love it. It's a privilege. It's who I think I am.
Just 2 weeks ago, LaPook was the first responder when a CBS colleague went into cardiac arrest and collapsed. LaPook arrived before the ambulance did and performed mouth-to-mouth and chest compressions. The employee later died at the hospital.
Jon was really shaken. He was upset that he didn't get there quicker, I don't know whether anything more could have been done.
I have to say, I was nailed emotionally by that. I really was. I hope I never get to the day where I don't get upset when one of my patients gets sick. And
when you don't get upset?
Yeah, I don't want that day. I want to be upset.
It's personal. It's real. He helps us. It's not unusual at CBS to have spend your whole life, your whole career involved with covering stories and working at CBS News, and you know, so it becomes family almost in a way. And he is our family physician. He really is.